Dr. John, board certified in internal medicine and geriatric medicine, and this is Think Your Health. What is Xanax? Xanax is a prescription medication to treat anxiety and panic attacks. It can be also used off-label to treat acute episodes of vertigo. It belongs to a family of medications called benzodiazepines. The generic name for Xanax is Alprazolam. How does Xanax work? Xanax works on a specific receptor in your brain called GABA. These GABA receptors are found in your nerve cells, and when they receive chemical messages, they help reduce or inhibit nerve impulses. A medication like Xanax can bind to the GABA receptor on these nerve cells. In this way, Xanax, like other benzodiazepines, has a calming effect on your brain. How long does it take before Xanax works? Benzodiazepines like Xanax are short-acting and reach a peak within 1 to 2 hours. What are the dosage forms of Xanax? It comes in tablet form, and the doses are 0.25 milligrams, 0.5 milligrams, 1 milligram, and 2 milligrams. The immediate release tablet of Xanax can be started at the lowest dose 3 to 4 times a day, and then you slowly increase the dose every 3 to 4 days depending on dose response and medication tolerability. The extended release form of Alprazolam is started at 0.5 milligrams to 1 milligram daily, and here again the dosing can be up-titrated depending on response and tolerability. In older adults, dosing and administration of Xanax should be done very cautiously. Why is this? Xanax, like other benzodiazepines, are listed as medications which are potentially inappropriate per Beer's criteria. This is because it can cause significant side effects in the older adult, which I'll talk about later in this video. Can Xanax be used during pregnancy? No, as Alprazolam and its metabolites can cross the placenta, it can cause harm to the fetus. And if you're interested in a medication called sertraline to help treat depression as well as anxiety, click right here. 10 facts you should know before taking Xanax. Number 1. I would strongly recommend that you do not drink alcohol and take Xanax at the same time, as it can worsen the side effects of this medication and cause harm. Number 2, preferably Alprazolam should not be used for a long time. This also has to do with how it works, as it is a short-acting medication and can be habit-forming, and you would be at a risk for addiction, especially if you do not follow the recommendations by your healthcare provider. The problem with long-term use is you'll be exposed to the side effects of this medication. Number 3, do not suddenly stop taking or quit this medication cold turkey. This can lead to withdrawal symptoms such as sweating, agitation, hallucinations, and seizures, and can be potentially fatal. Your dose would have to be tapered in conjunction with your healthcare provider over a few weeks or even longer. Number 4, would not recommend using Xanax as a sleeping pill. Yes, a side effect is drowsiness and sedation. However, as mentioned earlier, this can lead to addictive behavior. And if you're finding value in this video, don't forget to like, subscribe, and hit that notification bell, as it really helps this channel out. Number 5, Xanax does not cause direct liver problems. However, as this medication is metabolized in the liver, and if you have a pre-existing liver issue, you'll have to talk to your healthcare provider about adjusting the dose or frequency of your medications, as you might be faced with increased side effects. Number 6, what are common side effects? All medications cause side effects, and some individuals have no or only very mild side effects. There are many more, and I've only listed a sample of these side effects: drowsiness, sedation, memory impairment, depression, rash, weight gain, weight loss, libido problems, difficulty urinating, low blood pressure, confusion, GI problems such as nausea and vomiting, decreased appetite, constipation, dry mouth, headache, muscle pain, dizziness, coordination problems. Number 7, if you recall, I'm very hesitant to prescribe this medication to older adults. One of the reasons is when you age, the amount of body fat increases, muscle mass decreases, as well as your bone density. Xanax is fat soluble. That means ultimately it is stored in your fat cells. This is why the side effects of Xanax last longer in individuals who are obese and who are older. Number 8, Xanax can interact with grapefruit. Discuss this with your doctor if you are on grapefruit or grapefruit is part of your diet. In this video, another word of caution concerning older adults. Xanax, like other benzodiazepines, can increase the risk of falls. Be very careful when you're getting up from bed. Take your time, especially when you're going up and downstairs, especially when you're on this medication. Number 10, Xanax can interact with a number of medications, and I'm only listing a couple of these. Talk to your pharmacist or to your healthcare provider if you have concerns. As you can see from some of the medications, if you're on opiate drugs, some of the side effects of Xanax can be potentiated. So please work with your doctor, especially if you're a chronic pain patient, for the safest combination in your case. If you've been diagnosed with acute angle glaucoma or open angle glaucoma, you should not be taking this drug. And if you're interested in other videos, click right here. Oh, click right here. Have a good day and think your health. I'm running this and I forgot to tape it. Why am I stumbling over words? Can't I say the word problem? How many times did I say problem?